Hey guys, it's Mike. I wasn't actually considering making a video today. I actually wasn't considering making many of these videos. I was going to make more or less hair tips on my other page, but um, just lately, everything that I've been thinking about, few things that I've been through that I've already discussed on here and, made light of on here, but uh, um, I thought about it a lot, and I kept thinking of different things that I wanted to talk about, and not because, I want to hear myself talk or I think that my advice is gonna, be, not my advice, but again, like I said before, that I claim to be some sort of guru, but when a lot of people find it hard to talk about their own, open up about their own, um, personal problems. They don't make them, they're not public with it because they're, from many different reasons. They don't want to be judged. They don't want to be, they think people are going to look at them differently. And there's so many different situations, but I realized that, yes, I love doing hair. And the reason I love doing hair is because I want to make, at the end result, I want the person to feel great about themselves. And that's with every client. So it's wanting to make somebody feel better. And I realized when I made that video, the one main video that I made that was kind of long, but that I described the things that I've been through and how I got through them with the intention of giving hope to somebody that might not have it, or support to somebody that might have it, or letting somebody know that, that may keep everything inside, that they're not alone. That's the goal for me, and I can't help but feel that that's what keeps me happy and keeps me inspired all the time, is wanting to help people in some one way or another. And one way is hair, like I said, making somebody feel good about themselves. And another, I've realized by making these videos, I was going to make them every once in a while, but I may make them every day, I may not. Some people get bored of or don't bother watching them. It's fine. I mean, you do it because you do it for yourself. That's why we do anything. People should be doing what they love to do, regardless of what anybody might think or care about it. But what made me want to make this video today, basically, what started, let me start by saying, again, I want to inspire people, help people, because I'm in a better place, and I came through a rough time and etc. But I went and got my hair cut today, and the subject came up. The guy that was cutting my hair was getting knee surgery, and I was talking about how he would never take a pain medicine again because he had a tooth problem at one time, and they gave him pain meds, prescription pain meds, and what it did to him. And he said, I don't know if you ever watched The Golden Girls, which to me was comical because every gay guy in the world, I think, has seen The Golden Girls, every episode, like I have, like 35 times, and could say them by heart. But it was funny because he said there was an episode that he saw while he had this toothache, whatever problem he had, or whatever reason he was taking pain medication, and he saw an episode where one of them it was Rose or whoever, was taking pain medicine for headaches or something like that for years, 20 years, like that, and lost them, and what it did to her, and she wound up having to go to a rehab facility, etc. And so and he said, "That's stuff to me." I said, "I just want to feel like that. I wind up feeling like that. It makes sense. It doesn't." But I think the reason the world is the way it is today, and it's so different from when I grew up, and I hate to age myself by saying that, but at the same time proud of my age because I got through a lot and I've learned so much. But And a lot of my friends, I'm sure, can relate to this. I know a lot of my friends can relate to this, but some of them may not acknowledge it. But by me acknowledging it, maybe it'll help someone only because I worked in a hospital, I worked in a pharmacy before I moved up here. And the main thing for me, like I spoke with the guy that was cutting my hair today, who became friends with. He's a cool guy, and I could be candid with him. And I told him, I was honest with him. I said, what was it, about 4 years ago? I have a bad back from doing hair for so long, and I wound up on strong pain medicine for 3 months. And this doctor, I never took him before, but he made it he made it he prescribed a ridiculous amount of medication for me that I could have easily should have died from. Thank God I didn't. For 3 months I was on, and he to make his conscience okay, to be okay with it himself. My first visit, and anybody I found out, all of his patients, he would give you a little Bible. So I guess that cleared his conscience and made him feel better about either ruining someone's life or possibly ending someone's life. But anyway, so I wound up on this pain meds for 3 months, and I later found out I was on end-stage cancer patient medication dosage. So, which was absolutely absurd. Thank God I never followed the amount that I was told I could take, because I don't think I'd be here to talk about it. But pain meds and addiction, the past, say, 5 years, 6 years, has just exploded. I mean, you all know. I'm sure everybody watching or everybody that's listening to this, or most people I know have been touched by it in one way or another, either in their own family, and not just by pain medication, but some people have to take meds daily, like myself, for my panic disorder, or for depression, for whatever the case might be. But a lot of people are ashamed or don't share those kind of things. They're not comfortable sharing them, where I am, because first of all, I don't mind. If someone's going to judge me, they're going to judge me either way. So it doesn't matter to me. But if by me sharing it, it helps one person or someone's kid, because a lot of my friends now have children, that I know some are, unfortunately, it's sad. It's so sad that some of them, unfortunately, are dealing with cancer, the kids having cancer. And to me, that they're such strong people, because I can't even fathom losing my dog. I mean, I'm emotionally very, in that respect, I have to work on that part of me, which brings me to this book, Option B, which I think everybody should get. It's a great book. If you like reading like self-help kind of stuff, it's all like facing adversity. And I started reading this today, as a matter of fact, after this conversation I had with the haircutter. But I proceeded to tell him, about the 3 months, and then what stopped me, and this is where I believe everybody is in your life and everything happens for a reason, and at a certain time. A friend of ours in the neighborhood had asked my mother if I was on drugs, because I just looked tired, I looked awful. And I've never been so embarrassed in my life. And I was doing what I was told by a doctor that's supposed to take an oath to take care of you and to do right by you. And all of a sudden, these doctors were giving out pain medication like they were Tic Tacs, turning all these people and kids, literally kids, into addicts. And then I believe the government is completely corrupt. I always have, but they wanted to make all this money, so they allowed it to go on for years. Turned a lot of kids into complete disasters and emotional messes. Took all that away, made new laws, no longer all of a sudden stopped with, instead of giving them treatment to help them come off of whatever they would put on, and were told, oh, this will do you fine, you'll be fine, there'll be no repercussions. They just took it away, and then like I would say 50% of the people that I knew, or not maybe knew well and not knew well, just a lot of people I knew turned to heroin and all sorts of drugs that I never thought I would um, be so close to people that would turn to that. But in a way, in my eyes, it's not their fault because the doctors are the ones that caused the addiction over something that could be as ridiculous as a sprained ankle because it's all about the money, what they were getting kickbacks from whatever drugs they gave out. The more they gave out, the more money they made. And but for me personally, after my neighbor saying, "Is Michael on drugs?" which was very embarrassing. I mean, very embarrassing, and that was a wake up call. But then a week later, down the block, another neighbor friend of mine, his girlfriend was telling me a story, and I don't know how the story came up. I know I didn't bring it up, but she did, and she brought it up at the right time. Ironically, I mean, if you want to call it irony, but her brother was on the same medication that I was on, but he was on like a quarter of the amount that I was on a day, and he was also on how's it called? He was on Xanax, also less than less than I was on. Went to sleep and died in his sleep from an overdose. That was the first overdose story I ever heard. But that night, I dumped whatever meds I had hello, down the toilet. And for 2 days I was fine. The third day I woke up and felt like I was turned inside out. I've never been in so much pain. I felt like I was going to die. I crawled around my apartment. I literally thought, I felt like I was dying. And I proceeded to call the doctor and say, "What's going on?" And he asked me what happened. I said, "Well, I dumped the medication." And he proceeds to tell me, "Well, that's normal. You're going through withdrawal. You should be in the hospital," which is absurd. He was very like flippant about it. And then wanted to put me on something else to take care of the withdrawal symptoms. So he wanted to put me on something just as equally as bad and addictive. And I wound up going on long-term pain medicine for my back. I wound up having back surgery and then not taking any medication at all. I still take my anxiety meds. I have to, not every day, but when needed, almost as like a safety, because, like any situation, any tragedy, any struggle, you want to have like a safety there just in case you need, whether it be somebody or whatever it is for you in particular. Everybody needs like a safety button, so to speak, that just in case I need it, it's there and it helps you to cope better. But for a while I was ashamed, didn't tell anybody that for 3 months, 4 months almost, that I was hooked on these medications, and I knew I was, but I didn't think anybody could notice. And again, the doctor didn't even care. So I thought, the doctor gave him to me. It mustn't be wrong. Anyway, moving forward, I'm trying to keep this as short as possible, but I wanted to get this out because I got really pissed off today because as we're talking about it, he was getting pissed and we were both getting annoyed because it was all by the doctors, the people that are supposed to have your best interests at heart, and instead they were made money and made drug addicts and created the world we live in today. I mean, Long Island, we left Long Island and it became one of the biggest heroin. Linden, the town I came from, as far as I know, became a huge, not just Linden, everywhere you go really now. Heroin is a huge problem, and it's baffling that the world is the way it is today. And with all my friends that have kids, I've noticed that, I've known about, since I've graduated high school, about 8 or 9 people that are no longer with us because of a drug problem or an addiction problem of one kind, some kind or another. As recent as I mentioned my friend Vivian the other day, this year. And but her issue was pills and snorting anything she could get her hands on. She'd snort an Advil if she had it. We joke about that because I was trying to make light at the same time trying to deter her away from it, by doing other things or just trying to help out because for months I could identify a little bit what she was going through, but again, she had a 17-year-old daughter that had cancer, Carissa, and beats a horrible form of cancer. Carissa came through it amazing. She's a wonderful, wonderful, beautiful girl. And Joni, her sister. But Carissa, was pretty close to the end there. She was in bad, bad shape. And Vivian had to watch her, took care of her, of course, and was on top of her game and stopped with everything. And I think when Carissa got better, because we had so many conversations, she was afraid that she had a fear of it coming back. So to mask those feelings, because that's what people do, why people drink, why people take drugs, why people do whatever, that's obvious, to suppress shit. But she was always afraid of, God forbid, losing her daughter again or cancer coming back. And I think that's why she chose to do the things that she did. And in my eyes, I never judged her for anything she did. She never judged me. I don't surround myself with people like that, but I wouldn't leave someone like that either because they obviously, it's a cry for help, but they have no control. And I think she just had no control over her feeling, her fright of it coming back because of what she dealt with and how rough it was. Now, Carissa, this was another thing I got into talking with this guy about today, which also pissed me off. We went from the pill thing to, like I said, her daughter, my friend that passed away, her daughter had cancer, but beat it. And she's an upbeat girl. She's great in school, great boyfriend. She's got her life. She's got her shit together. She always has. She would take care of her mom. She would take care of anybody, and she'd give you the shirt off her back. But she doesn't live life. She doesn't identify every daily as a cancer survivor, which I think in some people do, and I don't necessarily agree with that because, yes, she's one of the strongest girls I know, especially at the age she went through what she went through, but she's not identifying herself as this is what I had, and I'm going to remember that daily, and that's my new identity. I had cancer. To me, if you get it and you're blessed enough that you beat it, I would think you maybe volunteer to help people that might be dealing with cancer, might be ill, or might be surviving it, or whatever the case might be. But you don't have to make that who you are, what you were, who you are. In other words, like I said before, your past struggles are what give you the strength that you have now. Well, make you who you are. And you're never supposed to stay in the past, ever. The past is the past. And what annoys me is that I found out through my mother's friend, who was an elderly man, worked in, I forget the name of the facility on Long Island, but that's where they used to test drugs and animals and all that. And it was sworn secrecy, but he was an old man and he didn't care anymore, and had said how they had a cure for cancer and AIDS and other diseases since, I think, 1983. Which didn't shock me. It pisses me off because we live in a society where if they brought out the cure to cancer Pharmacies go out of business. Oncologists go out of business. Um, it's disgusting. It's sick. So what do? They have people pay through the nose. Insurance is horrible. People go broke. People have to take out loans just to survive and live with a disease that there's a cure for. Um, we talked. He happened that the guy that was coming here today also brought up, which I really wasn't thinking about. I'm like, wow, you got a point. Magic Johnson was it 30 years now? Was HIV positive, and it was basically he had AIDS, and now it's gone. It's been gone for years, and nobody talks about it. And Valerie Harper, um, brain cancer, end-stage brain cancer. All of a sudden, it's gone. Nobody talks about it. They don't go on talk shows and talk about like, oh, this is what I did, and then this is what we think my doctor made it go away. Um, and it's just a sick, twisted world that we live in because now I believe that the government, politicians, whatever you want to call it, create this heroin epidemic and almost welcome it because it's making the country money, and it's a form of population control too. Um, they if they took away cancer and HIV and other diseases, um, debilitating diseases, there'd be too many people. So they have to control the population somehow, and it's a sick way to think. But what else? How else do you think about that? I mean, it's just absurd that with what's on TV, what kids have to the social skills that kids no longer are interested in, and with the internet, I think the internet was a huge positive and a huge negative, just like anything else. But um, I envy my friend that I know there's a handful of my friends that their kids either have brain tumors or um, cancer of some sort. And, I don't necessarily, especially if I haven't spoken to somebody in a while, to call someone out of the blue and say, do you need anything? Or, because that's what this option B book, if you want to read a good book about, resilience and finding happiness and all that, I love those kind of things and self-help and learning about yourself. It's a great, great book, but she talks about that. Like, when people hear about somebody seriously ill in your family, maybe let's say, or a friend, and it's cancer or it's divorce or something traumatic or tragedy, people tend to think not acknowledging it is helpful to the person because you're not bringing it up. If somebody overdoses in your family or has cancer, or one of your kids overdose, one of your kids have cancer, they're not, by you bringing it up, you're not reminding them. They'd think about that 24 hours a day, which to me is what makes them the strongest people out there. To be able to deal with that, to support their kids, to take care of them, to stay emotionally together as much as they can, because we all handle tragedy differently. But they're amazing people, and unfortunately, I know too many. But it disgusts me that there's if one thing, if you hear one thing out of this video, if you watch it, and I was just speaking to my brother about this, there's a documentary called Forks Over Knives. I'm sure a lot of people have heard about it, but it's about cancer and how there is no need for anybody to die from a heart attack, from cancer at all, and they're all professional professors, doctors. I saw something because I did a little research today when I left after I had the conversation with my friend cut my hair, and we were both kind of frustrated at the end, going, it's really screwed up the world today, and it is. You have to. That's why I think I have this. I feel like I have just this passion for wanting to inject some sort of happiness and, like, you know, lighthearted and also maybe positive um, lessons that I've learned, just to put a little good back into the world, because we live in such a different society. Um, it's so different and so much harder. And I would not trade growing up when I grew up to for anything. I wouldn't want to have children now. I give all my friends credit that do, because all of them that I've seen look like fantastic kids, have great attitudes, and are respectful and kind, and etc. But it's so hard because you have access to so much, and you have to constantly be on guard. I mean, just to be a parent today, anybody that's a parent today should, you know, I mean, they should get medals. That's why I think I am. I was born who I am for a reason, because I don't think I could handle being a parent, because I'm such an overly um, uh, the worry that I have in me, which unfortunately at times it's a chemical thing with the anxiety and the disorder. But I don't know how my mother and father raised four boys. Um, Especially my mother. I mean, a mother always going to worry about her kids, and we were all so close in age. But we were out doing things, and then as we got older, we were out going to parties, drinking, getting home late. It's like a constant. You're worrying for years. You have to be a solid, giving, selfless person to be a parent. And thank God I had a mother and father that were and took care of us. Did the best that they could, and we all grew up to be our own person. The family might be it might not have the same dynamic that it used to have, but does that bother me? It used to, because I used to, only because I used to think, what did I do wrong? Well, I didn't do anything wrong. It's if anything, I did too much and tried too hard and pretended to be somebody I wasn't, because I was trying to be with other people, including my family, members of my family, pretend to be what I thought they wanted me to be. And when you're not being authentic, and you're not being yourself, you're lying, and eventually that those relationships dissipate, whether they're family or not. And that's just the way it is as you get older, and it doesn't bother me. Like I said, it used to, because I blame myself, but I don't blame myself for anything. And I actually would like to thank anyone that gave that, like I spoke about problems I had as I was growing up and the things I went through, because it made me who I was today. And but getting back to as far as I went through the pain medicine thing, and that was something that I wasn't going to speak about because that is kind of private, but it's so common today and so sad that every family, I think, all of us know somebody that has had to deal with addiction in one form or another. And I'm so grateful that, again, I think having anxiety and panic disorder, I was always so nervous about, drugs and all that, that I never dabbled in drugs. I mean, heroin and all that, I wouldn't even know what it looked like if it was in front of me. But, I'm talking about like the real hard drugs that I never thought I know anyone that would do them. But meanwhile, now it's rampant. But when I was going through my own, that 3 months, that difficult time, and especially after I was done and I was over being sick, but I was still adjusting to getting back my mind and body back to normal and getting over that. I was judged. I know I was. I was looked down upon, and I was judged also by people I never thought would judge me. And I'm not going to get specific, but not many, but it just shocked me because when when there's something serious going on, whether it be an illness or an addiction or divorce or a death, you don't want to not say anything or say, I'm sorry for your loss, or I'm sorry, if you need anything, let me know. Well, of course, you're sorry for a loss, or you want to say, if you need anything ever, let me know. But then, most people say that realizing, and I'm learning in this book by this doctor, most people say that in society, and have always said that, but they don't necessarily mean it, because they know that most people aren't going to, especially people that are going through death or lost a child to an illness or an overdose, aren't going to say, well, yeah, I could use, I can even think of things, something that somebody would say they would need, but it's irrational things that they would need. Like, yeah, I'd like Father's Day to go away so my kids don't worry about their father, which they bring up in this book, which was a good point. Or I'd like you to take away the holidays so my kids don't have to grow up and spend every Father's Day without their father, which is one of the issues, another issue in this book. But instead of that, people should actually just acknowledge, not silence is deafening, I guess you could say, when someone's dealing with something serious. I think, and they say in the book, and again, I'm learning as I go along. I love books like this, like I said. And this person says, if someone or a friend of a friend passes away, instead of, if there's ever anything I can do, let me know. That is a ridiculous question when you think about it. Instead, it should be, well, is there anything I can do for you right now? Do you need anything right now? Or how are you feeling right now? Not, I'm sorry for your loss, because I know from experience, I lost my father. And all I heard was, I'm sorry for your loss. I got so sick of that. I knew people were coming from a place of respect, but they also, if someone truly is kind and truly genuine and sincere, they're not going to be afraid to say, well, look, I lost my father too. Or they're going to say something that, like, for instance, another example in this book, one of this woman's friends was, her child was dying in the hospital, and it's a very sad story, but the positive that I took out of it was, this Sheryl Sandberg, she's the CEO of Facebook. It's called Flash. It's a great book for people. If anybody out there likes to read self-help shit, it's like that. But our friend's kid was 13 and passing away. It's a sad story, but she said, I didn't want to go in and say, oh, is there anything I can do, or I'm sorry for whatever the case might be, because that's a open-ended question that somebody in that position would never, would never ask you to do anything. I mean, what do you say? But anyway, she had gone to the hospital and just called upstairs and said, look, I have an hour off from work. I'm here. If anybody wants a hug, just come downstairs and I'll be here an hour for anyone that just wants a hug or wants to sit and talk or sit in silence and doesn't want to be alone. Just offer something, do something. And that, I think, that relates to any situation, whether it be someone that's dealing with a child with addiction, or if you have a friend that has an addiction, instead of keeping your distance and not associating, be a human being. We're all in this together. We're all in this big shit storm that I feel is this. That's why I don't watch the news and I don't read the newspaper, because you watch the news, there's nothing positive but the weather that comes out of a half hour of news. You can watch, to me, I watch a half hour of news, I'm done. And at 5:30, I feel like jumping off the porch. Who's shot? Who's got this? What new disease is out? And then every other commercial is a new pill that, the side effects are stroke, death, loss of limb, blindness. Yeah, sign me up. I mean, it's all become so convoluted and sad, and that we have to create. We all have to do something to create happiness for ourselves first, which I feel I finally am at that point, but also help other people, which is why I feel so compelled to make these videos. And to some people, they might not be interested. To others, they might be, but it makes me feel better because, like I said, if I can give hope to one person, like when the hour video I made, which this one's getting a little too long and I gotta end it, but the one I made the other night, talking about my own experiences with coming out, with anxiety, with divorce, with death, with all the things that I came through and how I dealt with them and how bad they made me feel, and then how good I feel now, having gone through everything. If I gave hope to one person that is suffering in silence is like a slow death, especially when you think you're kids. But it's just, I would just say, and I would hope that people would automatically just think this, to just inject some happiness every day to anyone you can, whether it be like I've been lately, it sounds crazy, wacky, but well, may not, but it was in something else. I'd gotten it from somewhere. Somebody had said it, smiling at strangers, saying hello to strangers, waving, even if they don't answer you back. It just, most of them do, and then it just makes you feel good, and it almost takes them by surprise because most people walk by each other and like we're just robots and we're just existing. And I think if we don't make this a happy place to be every day and a happy life, however we can, then the alternative is just not an option. And speaking of that, this book is called Option B, and it's cool. I think it's cool because the whole premise is when you know that option A is no longer available as far as life in general, or tragedy happens and option A is destroyed, then you have to move on to option B. And most people are living life in option B with option B because option A is no longer there, no longer an option. But yet you have to choose to live option B, and like she says, live option B and kick its ass. And I think that's where most of us are because most of us don't have perfect lives. A lot of us do have struggles and stuff. Just a lot of people don't talk about them as much as I do. I think, Jesus Christ, I'm a yak at home. I can talk, about everything. But I don't know. For me, whether it's hair or from experience, things I've been through, if I could just inject hope into anything or help someone, that's what gives me fulfillment. It makes me feel even better than I do about myself than I ever have. And so that's about it. But I wanted to that conversation I had today just got me thinking about, if you have a problem, especially if you're watching this or somebody that's got a problem with medication or pain pills, or try your best to help them, to be there, to let them know they're not alone, that there's other options, that it doesn't have to be, life doesn't have to be that bad, or to just do whatever you can to try and help them, because so many people give up on people like that. And I had a touch of it in my life, like I said, but I didn't give up on myself, thank God, because I didn't have much support besides my mother. At the time, it was my mother and I, so she was the only one that I really let in on what was going on at the time. But if you know somebody with an addiction these days, go the extra mile, call them often, call them more, think of different things you could say, ask them how they're feeling today, not, oh, how you been, because they're just going to say fine, and that's a bullshit answer. Call them out on it. I know you're not fine. I know you're suffering. Because I wish I would have done that with Vivian. I know I couldn't have changed what happened with her, but I lost her this year, and now she's in a better place. And you know, you live and you learn, and all of us have issues, but that's a big issue today, and that's what that conversation got me thinking. And I wanted to make a video about it because it's just such a problem these days that it's so many people are dying and it's so unnecessary. So if you know somebody, just seriously think about it, and even if they're not super close, reach out to them because you might be the only one that does, and that's what's truly sad. So I don't know. My thing, like I said, just if I can help people, it's hair, it's talking about what I've been through, or advice, or whatever it is that gives people motivation or hope. That makes me feel great because there are a lot of times in my life that if I had that, things would have turned out differently. But I'm grateful because I had to learn it on my own, and it made me even stronger. So that's it. That's just my opinion, and I wanted to just get that out there. Um, you know, especially if it's your family, make sure. I think that's an obligation. Unfortunately, um, it was different for me, but I think when someone in your family is having a problem, the worst thing you could do is cast judgment or stay silent and not be there, 24/7, whether it be I'm here for a phone call 24/7 or I'm here if you need me, or because nobody asked to be in a position. So it's not their fault. And um, we should all be helping each other instead of trying to drag each other down. And I think some people are afraid, well, if I try and help, I might go under too with them. But the truth is, no matter what tragedy it is, we all have the ability, all of us. That's why, like I said, we're all in this together. Everybody's got the ability to bounce back up and pop their head out and breathe again. Which again, they state that that's another analogy they use in this book, and it's perfect. But a lot of people feel like they're going to be dragged down with them. No, if you're a smart person and a genuine, sincere, kind person, just help someone, call them, check in on them, because you could be saving their life because they might not have anybody in their life that cares enough to do that. So anyway, I hope this video wasn't too long. I don't know how long I've been up here for, kind of long, but I don't know. I hope it made sense to some people, and that if some of you are dealing with this, that you do something about it. So hope everybody has a good Mother's Day. I'm going to try and get to as many friends as I can, as many girls I can. All of my friends, all of the girlfriends I have, they're awesome mothers. I mean, and like I said, my mother is amazing. I mean, to raise four boys, to be a parent, especially these days. I mean, you guys are unbelievable. So happy Mother's Day to you guys, and everybody have a good weekend. And I probably won't be making a video for a few days because I don't want people to get sick of my shit, my talking, yakking, whatever. It's not my intention, but have a good weekend. I know it's supposed to be crappy weather, but spend time with your family then. Tomorrow, if it's raining, I don't know, do something different, do something fun, whatever. I don't know. I'm done with the advice thing now, but just my opinion. So have a good weekend and happy Mother's Day to everybody, and enjoy, and I'll talk to you soon. Have a good night.